Hello, my name is Jamey Fletcher, and today I'm going to speak to you about the benefits of exercise. I began working out during my junior year of high school in 2015, and I have consistently since then. Over time, I became more and more familiar with the ins and outs of exercising, and I found myself constantly helping friends and family with any questions they had about exercising in general. So I decided I would like to do this as a job, and I enrolled in the National Academy of Sports Medicine to become a certified personal trainer. The National Academy of Sports Medicine provides the highest regarded certification and is accepted by gyms everywhere, so I studied hard and became a certified personal trainer in November of 2017. Working with clients in a gym and tailoring exercise programs to their needs was an amazing experience. According to Peggy Williamson, in her book, Exercise for Special Populations, exercise has been shown to improve health and fitness in most populations. Today, researchers continue to demonstrate that appropriate exercise interventions can result in life-improving gains in fitness, reduce health risk, and enhance well-being. In this speech, I will inform you how exercising regularly has many benefits, such as disease preventative properties, and also benefits for people with heart and pulmonary disease, bone disease, depression, and is very beneficial for brain health. This chart shows that there's a 52% higher risk of premature death, a 39% greater chance of developing diabetes, and a 26% higher risk with heart disease associated with poor fitness. And this chart from the American Heart Association shows cardiovascular disease deaths versus cancer deaths by age. The blue bars are for cardiovascular deaths and the red are for cancer. And it's showing that cardiovascular deaths are surpassing cancer deaths by each age group. Not only does exercise aid with the prevention of cardiovascular disease, but the use of exercise therapy in heart failure patients has been supported by several clinical trials, and the most recent being the HF Action study. However, it is shown that only 10.4% of eligible heart failure patients receive cardiac rehabilitation after hospitalization, so it is important that these benefits are revealed to everyone so that they can be implemented more often. In September of 2017, results of one of the largest international studies on the benefits of physical activity were published. Data from more than 130,000 participants aged 35 to 70 were assessed for physical activity levels, mortality, and major cardiovascular disease. These were followed for 7 years. Higher levels of physical activity were associated with a 28% reduction of risk of mortality and a 20% reduction of risk of cardiovascular disease. Apart from cardiovascular health, exercise has been shown to be very important in regards to bone health. Osteoporosis, falls, and related fragility fractures represent a serious and global public health problem. 30 to 50% of women and 15 to 30% of men will suffer an osteoporotic fracture in their lifetime. In 2014, a study was conducted to show the impact of adding weight-bearing exercises to medical treatment of elderly patients with osteoporosis. It was concluded that the addition of weight-bearing exercises as well as non-weight-bearing exercises increased bone mineral density as well as the quality of life of these patients. This chart shows that each year in Canada, there are about 30,000 hip fractures, and many more Canadians suffer osteoporotic fractures affecting the spine, wrist, shoulder, and pelvis. 1 in 3 women will suffer from an osteoporotic fracture in their lifetime, and 1 in 5 men will. 37% of these men who suffer a hip fracture will die within the following year, and 28% of women will. Moving on to my next point, I will now discuss how exercise has been linked to improve and reduce the risk of depression. It is generally known that physical appearance is very important to most people, so when people are not happy with the way they look, it is not uncommon for them to view themselves negatively and use this as a source of depression. Exercising is a great way to improve one's body because you can use many different exercises or programs that fit each person's specific needs or wants, and when someone is happy with the way they look, chances are they feel a lot better about themselves. If a healthy adult exercise for a minimum of an hour each week, the risk of incident depression can be reduced by 12%, a Norwegian Perspective cohort study has found. To date, the strongest evidence on the benefits of physical activity and depression comes from randomized controlled trials in which changes in depression severity have been assessed before and after a prescribed exercise intervention. Meta-analytic reviews have supported the antidepressant effects of exercise among otherwise healthy adults, chronically ill patients, and patients with depressive disorders. 3 recent Cochrane reviews have each concluded that exercise is moderately more effective than a control intervention for reducing depression symptoms. This chart shows the long-term impact of exercise versus medication on depression. It shows that compared with participants in other conditions, those in exercise conditions were more likely to be partially or fully recovered and were less likely to have relapsed. In conclusion, exercise has been shown to provide many benefits that help with cardiovascular health, bone health, and mental health. It is important that people are informed of these benefits so that people can use exercise to its fullest potential and in turn can live a better life.